Assistance. Oh, there we go. We're recording now. Okay, so next slide, please. Okay, welcome. You can introduce yourselves in the chat, and you can use this part to go to the agenda. Good morning to you all. Yes, if you can please type your names in the chat where you are joining from. We have a lot of people, so we are very happy. My name is Holly Radice. I am the representative of CALP Network working in Americas, and it's a pleasure to be able to be with you today here. The agenda today is very simple. We are meeting each other, and then I will give Juliana the floor. She has directed this study, and she will be talking. It's very important. She will be presenting the study, and then we'll have conversation with Camila Salas from Caritas Ecuador, and then we're going to leave some space for you all so that you can have a couple of commitments. So, Juliana, it's yours. You are muted. Here we go. Perfect. Thank you, Juli. So it's important to start this space thinking in the demographic and with the ethnic groups so important. As you know, the Afro-Colombian and Afro-descendant Colombian people is so significant. Notwithstanding, these are groups that are at a high vulnerability level in the region with difficulty to access to healthcare and to healthy living conditions, and that is why they have the propensity to receiving humanitarian assistance throughout the region. They are also who are most effective in a disproportionate way due to emergencies because of violence or because of climate reactions or inaction, or their vulnerability is very high. And that's why it's important not just to be able to have an assistance, to be able to respond to those social dynamics, but also to be able to understand that within them, there is a social and cultural dynamic that are characteristic of them, and that are different from another type of population, not ethnical, that requires attention and a cultural approach to be able to have an intercultural health that would help us with the intercultural needs of these people. Next slide, please. Next slide. Okay, the limitations of this study. There were three. Firstly, to identify areas of work and humanitarian assistance and programs implemented by organizations and strategies focused on CVA, targeting Afro-descendant and indigenous peoples in the region. This clearly with an approach to CVA programs. And then to document existing practices and identify if gaps are present in the assistance, so to speak, so we can provide recommendations based on the views and suggestions of organizations and people that participated in the interview phase of this study, which are not just recommendations, but also suggestions to be able to improve the attention towards the ethnic people in the Americas, to be able to have effective and relevant culturally to the programs, and to share experiences and lessons learned, and a discussion space to be able to promote and knowledge exchange, and that we will have it also as we finalize this space as an space to be able to improve this towards future and as an intercultural approach adapted to the people in the region. Next. Okay. And to also mention that the information compilation started with the database of a study launched last year called Let's Go llamemos hacia atrás, and now let's keep this in the Americas. And as from the database that we were able to do in this space, we did a search, word search, to be able to identify the documents where the ethnic people, Afro-descendants, and indigenous people are mentioned in English and in Spanish. Um, and so that we are able to make reference in a very general way, especially demographic data, where this wasn't approached from an intercultural approach or a differentiated approach through the communities. And so this lack of documentation is presented as one of our big limitations because of a limited amount of information that was able to be found in terms of how the cash transfer and assistance is being and the and CVAs are being approached to the people in the region. Okay, so one of the other limitations of the study is the participation of local actors so that um, we could do a call to participation from our local actors from the region. And the call was not received. We did not have local organizations participating in the study, which would have been very valuable to know the perspectives of the local communities and who are within the territory as well. And within this exercise as well, we were able to identify the um, lack of experience with Afro-descendant communities and not just what was found in the literature, but also um, the from the shared experiences with the organizations that participated in the interviews phase. We had a first phase with the international organizations and national organizations and with organizations that were not humanitarian. And also a second phase of recommendations where these organizations that participated in the first phase could share their findings regarding those shared experiences in the first phase of the experiences. Next, please. As I had been saying, there were 18 interviews that were conducted with humanitarian and non-humanitarian actors in Colombia, Brazil, Ecuador, and Guatemala, in mostly Colombia, from the organizations that most participated in this phase of interviewing. And in the second phase, an event was held, as I had mentioned, where comments and suggestions were collected to for the last phase of the study that was answering to one of the objectives and goals, which was to have recommendations and suggestions to be able to implement a more inclusive approach to the people, and that would adapt culturally to the needs of these populations. Next. Okay. We're going to present the challenges that were identified at this point. These are the results that came out of these interviews with the different organizations, and we were able to identify some challenges in the CVA with the ethnic population of the region. Next. The first one of these was accessibility and logistics. One of the huge challenges that the humanitarian actors faced was the access to a lot of these communities, even though a huge part of the parts of the country are in populated urban centers, and but although a big part of the population is in geographic isolation, um, or with lack of infrastructure, where it's very difficult to access so that the humanitarian actors can increment the operative costs and also the process of security in the territories via different um, armed actors or different situations that affect the integrity of the humanitarian actors. That was like one of the first challenges that were found to be able to access the answers to these populations. Next, please. Um, then markets, given the geographical conditions of a lot of these populations, we were able to identify that accessibility for financial for humanitarian actors was difficult, and the access to financial actors and functional markets that would allow the cash delivery to these communities could be done in an effective way and that responded to the necessities of these emergencies, and it was very limited. As I was mentioning, the lack of financial providers within the area, also access to places where the transfers could be received, and also um, so that they could receive the assistance. And then because of the conditions of violence and of security, which uh, where the transfers that these communities could receive were stolen. And so that was one of the other challenges of this assistance. Next, please. Uh, because of the high vulnerability in which the indigenous populations find themselves in, another of the barriers that were identified was the access of identification documents. You know, that in order to be able to access cash transfers, there's a registration process that is gone through with identification documents to be able to do traceability of the deliveries. And a lot of the times that some of the communities didn't have these IDs because of whether it was geographical barriers or because of where they lived or linguistic barriers or um, so this was reflected a lot more within the indigenous communities and they wouldn't get close they didn't approach to get registered because of discrimination or cultural dynamics that within their uh, cultural build of their of their towns. This accidented dynamic of their IDs was also something that limited the access to the cash transfers. Next slide, please. And lastly, well, not lastly, but another of the challenges, and I think this was one of the big ones that was identified. I think it's the lack of integration of the cosmo vision of the the cultural practices and dynamics of these people within the assistance, which makes it so that the attention is not centered in the people, where the efficiency and effectiveness are limited because the indigenous communities and this population have different ideas when facing money, and the logic and understanding of how humanitarian assistance works, and when there isn't an approach from the language recognition, and that there are cultural differences between the communities, which could generate a class between the communities that are taken care of, as well as the humanitarian personnel, and how to understand, like I was mentioning at the beginning, these are highly vulnerable regions. And so this also generates dissatisfaction towards the assistance that is delivered because of the lack of clarity and because of the lack of adaptation, the cultural adaptation of the humanitarian assistance in terms of how the communities are receiving or perceiving this help. Next slide, please. And lastly, there is the perception of assistance, um, or a perception of attendance, is where the over attendance by where the organizations, local governments generates duplicities, and so that also generates a disconnection and a resistance a lot of times to being taken care of, um, we cannot, or it is unsuccessful to deliver this assistance because of the this dynamic in the communities. Next. Okay, after these challenges that we were able to identify, the perception of assistance, the cultural topic and the barriers with documentation, the market topic and accessibility to these markets and the communities as well. We were able to identify with the organizations that notwithstanding these challenges, which were the recommendations that would allow us to improve in the future so that um, uh, for those who are interested in working or helping in a more adapted way with these communities. Next, please. Super important. The first recommendation, and it's to design PTMs for and with the ethnic communities where the delivery must be centered in people. Uh, Understand that the PTM needs to be adapted to the cultural um, communities, and we need to incorporate the cosmovision of the people so that it aligns with their financial and social practices. It's the to conduct pre-studies to understand the local cultural and economic dynamics prior to implementation is very important so that it's centered in people and it's also community or locally led. It's also very important within this approach and with these previous studies to um, uh, work at a community level. You know how leadership is so important at the in indigenous communities and also the effectiveness of working in a very close way to these traditional structures like the cabildos in the Colombia case for indigenous people and also for the community uh, people so that we can facilitate or make sure that these internal structures are respected and that it could be there could be trust generated at a community level. And it's also very important uh, to to train personnel. You will see that there are instances where local personnel was included that would speak the indigenous uh, language, and that would facilitate the delivery. Um, and it also added to communication and allowed the programs of the assistance programs to these communities to be adapted. Um, this would allow a huge uh, improvements so that the experiences of the people could be visualized and incorporated within these humanitarian strategies at a humanitarian level. Next, please. As I was mentioning earlier, to fortify the local response is very important because it generates within the um, exercise of the humanitarian um, level. Next, please. Incorporating financial education is also one of the recommendations that were highlighted within the study because a lot of the times the ideas with which the humanitarian actors, which are a little more Occidental or Western when in terms of the idea of the coin or the currency, do not are not close or do not belong to the ideas of the communities, especially for those who are in more isolated spaces where the financial dynamics are more bartering and exchange. And so incorporating a program, a cash transfer program within these um, communities is makes it key to incorporate these strategies to be able to fortify and adapt these strategies and to collaborate with local cooperatives so that the community structures can be fortified. And it's also very important to evaluate the use as cash transfer prioritization, always focusing on alternative mechanisms that do not depend on commercial and known uh, actors that do not know the full story. And super important. Next, please. This is a something that this research study leaves us is the lack of documentation leads to huge learning, which we we need to begin to systematize a lot of these experiences that have not been identified by this study, uh, and mean that doesn't mean that they're not happening. There's a lot of the work and a lot of the things that are being done in these communities, and that information is not documented yet, and it's very important. And it's an invitation for you all as actors and humanitarian actors to be able to begin to document more of these experiences because they can be used for other exercises or programs that are being developed, whether in the same country or other territories, and allows the exercise of feedback, knowing what the rest of the people are doing and how this could work for this type of population. And this would allow us to close the gaps, the information gaps, and contribute significantly to these more inclusive responses that are sustainable, systematized, and for the people, and that they are always in the center of the assistance. Next, please. Okay, those were our recommendations. You're going to be able to know a little more of this information in the study, which we have it in English, where you're going to be able to know a little more about what the actors, the humanitarian actors, have shared with us throughout their interviews in various countries of the region. And now we are going to go to this dialogue phase of conversation with our colleague Camila Salas, who is a national technician in um, cash transfers in Caritas, Ecuador. Because she's worked with ethnic communities in Ecuador, and so her experience is super valuable and super on point in terms of what has been mentioned in this study. Hello, Camila. Hello. Good morning. Thank you, Camila, for joining this space, this conversation space. I'd like to, well, firstly, for you to very briefly introduce yourself, and then we can go to questions. Good, thank you very much. Good morning to you all. It's a pleasure for me to be here in this space, and thank you very much for inviting me. Like I was introduced, I'm a national technician in cash transfer programs, and I'm in Caritas, Ecuador. Thank you, Camila. Okay. Firstly, or first of all, the question I have for you is from all of this shared information right now, and you've read the study, how could you or share an example of an initiative or a successful approach that has improved the inclusion of ethnical communities? Yeah, thank you very much. So, in fact, part of the experience that Caritas Ecuador has had uh, is the first one is that when at the very beginning we were beginning to implement the cash transfer programs, um, one of the communities where we were able to get was in the northern frontier of the country in Cachi with Agua borderline, and we were to be able to arrive to reach them and to explain to them how we were trying to intervene or in some way tried to apply some assistance. And so mainly for this type of populations, we prioritized the considering that the most for the most this community speaks Aguapi, and so we tried to talk to leaders that dominated the language. And so throughout although this experience allowed us to be able to get close to this communities effectively, we also learned several other things. And as we were mentioning, to be able to prioritize these communities, consider the time of transportation and moving, and documentation needed to be signed, and we guaranteeing that the families that didn't have documentation or ID, or that had difficulty signing because they had a low educational level, uh, they accepted through these options even with the provider, so that we could guarantee the access through provisional ID, and to also be able to identify that a lot of the entities weren't signing, and so communities weren't signing. So to identify some facility for facilitation, so that the families could sign. And in other cases, as a response to emergencies, because of the El Niño phenomenon that we saw, was the response to the flooding in Esmeralda province and in cantones and neighborhoods like Atacama, etc., were the with presence of Chachi community. So from these communities, we were able to identify that there were already leadership roles within the communities that would allow the access, and the call to action, and also to be able to approach this community from the locality. But notwithstanding, these communities had limited access to the local market. It was also part of the challenge as an organization, right? So to be able to um, see that this was assistance this was being given to, and also there was an intervention with food coupons, and also the articulation with organizations from the province, as for example, with state institutions where they were able to facilitate transportation, so that the families could get close to the points where the shops were located, and that way they could also see that all of the families were able to make use of the coupons, and that they could choose in a freely, they could choose freely and in a dignified way what was available to them. And that was um, mainly the initiatives. We also had intervention in the Guayaquil province, where we were able to identify communities that are identified as mutubios. And so it was like these experiences that we had, and also the challenges, the the mobilization distances and logistics that needed to be intervened. Yes. Thank you very much, Camila, for sharing these experiences. And I'd like to ask you, for you, which have been the facilitators that have guaranteed that the assistance was an intersectional, intercultural, and that it would respond to the dynamics of these populations? Well, one of the main facilitators is to be able to understand and to contextualize the programs towards the communities that we are going to intervene, and even from the first diagnostics, right? To be able to intervene, there are community leaders and the language barrier, if it's necessary to get translators, so that we could have better contact with the communities. And considering that the language is one of the main barriers that we are identifying at the time of being able to access, right? And another aspect is seeing the communities not as participants or beneficiaries like we normally call them in terms of the cash transfer programs, but also as partners, allies, strategic allies, because they already have their organization structures and their time as an organization, and it's also important to identify the community leaders that are recognized, but also the ones that possibly are not so recognized, not from the gender and age approach. And I also wanted to share a little bit of um, let's say how much have we been able to reach with Caritas to the Afro-descendant communities, right? Considering the results of the study, where we don't have so much information and what is the impact that was generated from cash transfer programs. So, um, well, um, um, part of our registry as Caritas, for example, had been taken place of the data, and also from the current context um, as a country, and in terms of the displacements that are being presented, we were able to identify that since 2024, 2025, our assistances or our programs have also been increasing in a greater number from Afro-descendants that we're being able to identify. And even prior in 2023, 2024, we identified communities, YU communities, which are that are in the north part of the continent of South America. So it's also seeing how can organizations adapt their programs to be able to provide a better response to the ethnic communities, even if you can see throughout through the rest of the years, we're already, even though it's not a big volume or high volume, we're already identifying communities. For example, Waco, Wadi, Tubio, and even as I was mentioning, the Afro-descendant communities are already, population is already increasing because of internal ascendants. And so the internal displacement phenomena um, is also majorly in the region, and also mobilizing towards uh, cities in the mountain ranges where everything is a lot much different, and so from that standpoint can be approach to the communities. And so we also been able to identify the Chachi communities, Awa and Afro-Colombian even, which are displaced from those countries. Thank you, Camila, for sharing these experiences. Well, because of time problems, we're able to advance to part of of this invitation, and we're going to have questions for whoever we can accept questions for anybody else has questions for Camila. This is a space as an invitation to action and to think about all of this information which we received at this point, and your impressions to be able to work with ethnic people, and how would these commitments that you would like to have to generate or to implement cash transfer programs that are inclusive and led. Um, I'm going to share a Menti survey so that you can give us your answers. Let me know if you get the link. Okay, perfect. There it is, so that you can leave these commitments and those actions so that you can commit and to generate an assistance that is led locally, so that you can consider the dynamics um, for these populations. I can't see them. Menti. Perfect. If you can't see it, Holly, I'll snatch the screen from you super quick, and I'll present the QR code so that you can open it from the cell phone. for the necessary purposes. Yes. Well, it depends on the design of the program that um, when it depends also on the objective of the program. The cash programs or the transfer programs are also dependent on the modality and the mechanisms, and so that they can be restricted or they can also be conditioned, even as how do we look to achieve the objective of the program. And also, as the case of Caritas Ecuador, the objective was to be able to respond to flooding so that we can guarantee that people have hygiene products and cleaning products and food. So our coupon was limited to um, to being able to buy cleaning products, and so that way it is guaranteed that those needs are specifically designed so that we can acquire those types of products. But um, it depends also a lot the criteria and where you want to arrive, right? But we also had programs with multi-purpose cash, and so that we could guarantee the access to food. The multi-purpose goal is so the families who want to access so that we know what they're going to use the resource in. So that depending on the evaluations, the criteria, and how the families are identified, we can also that the families do a adequate use of the money, and in this case of the mechanism through which they would desire to be, or how they would like to intervene in that case. And it's also applied to ethnic communities and also Afro-descendant communities. The important thing here is to be able to identify how to respect the cosmovision and the organization, and also how they get involved and are part of the design, the response, and identification towards the people that are being intervened. Thank you, Camila. We have a question here from Alexandra Guzman. Given the context and the sensitivity of the indigenous people, what lessons learned are there about the partner selection so that it could receive CSB and the distribution of money according to the number of inhabitants in that home? Well, if I understand the question properly, it is related to how can we do this differentiation depending on the amount of inhabitants. And so in the case of Caritas Ecuador, we um, in the last year we have already realized this differentiation with the amount of inhabitants, because how a difference of $120 affects a two people family versus the five people family. So what we did is so that the needs can be covered in better measure, and so that you can also cover the specific needs of kids, children, teenagers, if they are elderly, or people with different capacities or disabled. Thank you, Camila. I will present the Menti with your responses, but if you have more questions for Camila, leave them in the chat or you can raise your hand. If you, here's my screen. Thank you. Okay. To this question about what actions what actions do you want to commit to for implementation of cash transfers that are more inclusive and locally led and centered in people? Well, previous consultation, super important to know and identify, and to also approach the communities to be able to understand their dynamics and to be able to approach or get close to generate that trust for assistance and also yeah empowering of communities and to commit with local communities in all phases. That's super important too, and it's a call from the study, right? To center assistance in people and that they are also led locally and especially in these times that we are in right now. To work articulately with this organism to be able to include the cash transfer concept and with communities, formulate strategies with more participation of the communities and to involve local personnel in the analysis to be able to guarantee the appropriate localization alliances with Indigenous organizations to be co-implemented organizations. Super interesting, this commitment, yes. And super valid within this exercise of empowering communities and to be able to empower Indigenous organizations and who those who understand the needs better, yeah. Fortify experiences and systematize them is super important. I think this exercise of this study allowed us to understand the importance of documenting those experiences. Because as we were saying, it's not that they're not being done, it's that they're not being documented. So that's super important to document this as an exchange exercise where ideas and learnings can be um, experienced so that we can support other organizations that are implementing organizations. Recognize Afro-descendant and Indigenous communities. Correct. It's our responsibility to be able to give ourselves to communities. To orient the CVAs to other communities and participants, and also adapting the attention to the communities and not the communities adapt to us or the assistance that comes from the outside. A lot of the times, um, the needs that they identify do not uh, correspond, and also to identify the personal behavior that speaks the local language. And so we had two cases, for example, for YU population attention, where the actors of the humanitarian personnel spoke Wajulaiki, and that generated a change and an improvement in the exercise of the assistance. It facilitated communication, it facilitated that the assistance could be delivered in a more effective way, and that the community felt integrated. And it's not just speaking the language, but also that that we have documented with tools that are in Spanish and but also translated to the indigenous languages, and to also keep in mind the assistance and also optimize vocalization processes um, that slowly but surely it becomes a reality so that we can make use of the program to work with indigenous communities. And fortunately, we don't have complaints about not working with Cosmo Bijuni. That's pretty awesome that um, you haven't had complaints about the assistance, meaning the assistance is being handed out in the correct, appropriate way uh, to do training and capacitation or optimization of capacities. That's super important. There's one more question in the chat. I don't see the chat, but it's a question I think for I think it's a question for you, Camila. Yeah, it's one about challenges Yeah. What strategies were implemented and what strategies were implemented? So in Esmeralda community, the implementation that was done of the courthouse of Esmeralda was those who offered, I'm sorry, not the courthouse, but the mayor's house. And so it was implemented in such a way that that when we mobilized to the social canton in Faro and Misne, the families in a community action, the day and the time in which the purchase of the products was going to be done was established, and also the return. And what other challenges? Well, also part of the intervention that was done and within the process of the program was the post-distribution monitoring. We already had tools that we adapted depending on the emergency and also of the response, but a lot of the questions were in Spanish. Um, um, and in the community, there was a young leader who also communicated in Spanish and in his community's language, but a lot of the questions weren't very well understood, even when we addressed the leader. And so that was one of the lessons learned from being in these communities, was to be able to identify in a previous manner the language and if we needed any type of translation, but also to be able to make these tools of a better social comprehension. So that was one of the challenges that happened, and so we approached them opportunely. Uh, Thank you, Alexander. Another question from Alexandra was, in indigenous communities, were there conflicts or tensions selected when only some families were selected for transfers, or do you recommend selecting all of the partners in one community? Okay. Yeah, in fact, we did see, or it happened to us then, it was in Esmeralda as well, because some of the families and previously, having previously explained what the qualifications were, because all of the community considered that they all were affected in one or another way. Even in some of the strategies that they chose to use was to be able to share the foods that they bought at the store with the people that weren't selected. And so, in that sense, it also generated sort of a tension with the community. And what this left us was that within the process of identification of the families, you can involve the community and not just with the people that provide the information, and how the access protocols are, but also to be able to from the design, from identification of involvement, because it might generate actions that harm the community. And so this is one of the things we did. Thank you, Camila. Okay, I'm still receiving commitments in Menti. A lot of them are very important and super valuable. Hopefully, you can put them in action within the implementation exercises that are being developed with the organizations. I don't know if there's a last question for Camila or for me. If no, well, uh, oh, oh, there's a question there. Uh, some indigenous communities can be seen in different manners when in terms of the international treaties. For example, some communities consider uh, teenagers as adults from 16, while legally the age of majority is recognized at 18 or even 21. In this context, how should NGOs deliver programs or services aimed at young people when they are already considered adults by the communities? So the question is, how should organizations um, deliver programs aimed to the youth when some communities have an identification of majority age or come of age in different stages depending on their communities. I don't know if you want to answer, Juliana, but I would say that part of what we were talking about in an event was localization matter because even though from the point of view of organizations that we were seeing in the question, they have already as a procedure, they have standards established according to procedure. And so from the community, in this case, there are ethnic communities like you were mentioning, that they are considered as a grown-up or they're considered grown-ups at 16. And so to be able to design programs from the grassroots and from there on break these or do away with these uh, ways of working that have been developed in a lineal manner. And that's what we want to deconstruct with that structure of how do we intervene with transfer programs and also with humanitarian aid, and also from those aspects to consider how the transfer programs will be adapted to those contexts as well. Thank you, Camila. Okay, this is the last question. PTN, the C, CSVs are limited in terms of um, issues in this regard, and Indigenous communities are satisfied with these two areas or have expressed that they are required to support them, especially in the reconstruction or production. So the answer to that question is that in this context, the communities or most of the communities that have given us results for the Rizacal study is that it was over these structural difficulties that the communities the indigenous communities and Afro-descendant communities have already with access to public services and also to means of life as well. It's also it's mostly not something that we could consider something that the community needs because they also have organization ways and forms of care. And in the case of health, for example, they have their customs and of ancestral treatments. And so what we need to reinforce in this message is to see what the community actually needs and to see how organizations can actually accompany those processes, because it's also important to understand that us as organizations will not reinforce the communities. They have their own capacities. And so we're going to see how the cash transfer programs could be intervened. And so we would see as in the monetary in the cash transfer programs, we could see that the monitoring of food, we could also monitor some sort of a structure and means of life, because the community normally does not uh, look to depend on any community, but they actually uh, try to have it as a practice of their way of life in a sustained manner. Well, thank you very much, Camila. Thank you for the helps and shared experiences that you provided today. Also, thank you to you all for participating so actively with the questions and for setting your commitments on Menti. We will be providing these and sharing them with you so that you can read the study in the blog, and we will be sharing this with you all. Thank you all very much and have an excellent rest of your day.